Making this video is just like giving a PLAB exam for some reason. You need to be natural, you don't need to sound scripted, you need to be presentable. So anyways, let's start with this show. Hello everyone, my name is Alip Qureshi and welcome to my YouTube channel. In today's video, we'll be discussing everything you need to know about PLAB. A Professional Linguistic Assessment Board Test, or PLAB, is a licensing exam for the international medical graduates to practice in the UK. So for this exam, you need to have a primary medical qualification, which in my case was MBBS from India. The next thing is you need to have your English exams, which is IELTS and OET. In both of these cases, these exams are divided into 4 parts, which is reading, writing, listening, and speaking. For IELTS, the eligibility criteria is 7 in all bands and 7.5 overall. While in OET, the eligibility criteria is 350 band score in each of the sections. Now you have done your IELTS, and now you need to register on GMC online and make an account over there. Look for the dates when PLAB 1 arrives. Now what is PLAB 1? PLAB 1 is a theory-based exam in which you'll have 180 MCQs to solve within 3 hours. Now why is this difficult task for some people? The thing is, it is a pencil and paper based scenario, which I knew, but the thing is that on the day of the exam it was a bit more difficult because the questions were in a booklet form. So they say that all the questions are at least half a page long, and you have 5 MCQs to review it from. So it is very difficult. Once you have finished, even if you are finished within the time frame, you don't generally get time to review all of your answers. So that's why you need to manage your time very well. Now there are various things to prepare your PLAB 1 from, like Plabable, med revisions. If you want to know more about it, please do drop your questions in the comments. I will be happy to answer them. Now once you have passed PLAB 1, you need to book a seat for PLAB 2. You have 16 stations in PLAB 2. You need to pass at least 10 of them, and you need to have a minimum score on that particular day. For every other day, the minimum score is different, so there are a lot of variables. While going for PLAB 2 in the UK, you need to decide on which academy you want to go to. You can go to any of the academies. Every academy has their own pros and cons. If you would like to know about them by me, you can put it in the comments. I would like to make a video about it in the future. So every academy has their pros and cons, but eventually every academy have candidates who pass. Now how do they pass? Every academy has recorded lectures, online lectures, and the notes of most of the academies are the same. So what people do is people start practicing way before they come to UK with people who are already practicing, like 4 months, 5 months. This will help you to get a better idea of how the UK system works. And trust me, PLAB 2 is an important exam because the way we interact in this PLAB 2 scenarios are exactly the way you will interact with patients in UK. So you have selected the academy, watched the recorded videos, started practicing with your peers. Now at least 4 weeks before the exam, you need to be in the UK, because most of the offline lectures take at least 2 weeks. So you need 2 weeks to attend those lectures and then 2 weeks to prepare. This is cut time frame. If you don't have much time, you cannot spend a lot of money in the UK. That's why I would advise you to start practicing while in your home country, and in 4 weeks start practicing in the UK, which is more than enough. And hopefully you will pass this exam. It depends on a lot of factors as such, because sometimes the GMC keeps on updating the PLAB 2 stations, and some new stations are really difficult and some people just fumble. But what you need to be is like, you are a doctor, just behave the way you would behave in a clinical setting and talk to the patient. If you don't know the management of some scenarios, it is okay to say that I will consult with my senior. I will do that. I will do this. I don't know that. I don't know what exactly is going on. One of my cases, I was confused between two things like acute angle closure glaucoma and optic neuritis because the patient was having severe pain. But fortunately, I said that I will discuss with my senior, and I got a score of 3 in management. Hello, I just noticed that I just said that uh, I don't know this. I'm sorry, I don't know this. It's not okay to say that. You just need to be confident enough and calm enough and accept that I am not sure what's going on. So I'll consult with my senior and then come back to you. So don't just blatantly say that I don't know anything and expect that you'll get a 3 in management, but it's better to put the words correctly. And what I did was I told the patient which two conditions I was suspecting, that is optic neuritis and acute angle closure glaucoma. So if you know the condition, so it will be better that you tell the patient what conditions you are suspecting, so the examiner at least knows that you know what it is. You're just a bit confused. So hope this helps. All the best. So this is the thing about PLAB 2. It depends on the examiner that is examining you. It depends on the patient who is giving you the history. It depends on you, and it depends on the other people who have performed that test. Now, once you have cleared PLAB 2, you are eligible for a GMC registration. Now, before the GMC registration, what you need is that your primary medical qualification should be verified via Epic, which is its own process. Okay, so only apply for this application once you have your Epic verification done, because within 28 days you need to submit all the documents to the GMC once you have submitted the application. That's why Epic verification should be done before submitting the application. Now the documents I would recommend to keep in handy would be a scanned copy of your passport, a scanned copy of your primary medical degree qualification, whatever it is for you guys, IELTS and OET certificate. I think in OET you need to go to the OET portal and ask to send the report to the GMC. While in IELTS you just need to give your ETGRF number and your IELTS certificate. Then a good standing certificate from your home country and your internship completion certificate, which is equivalent to F1 post in the UK. So all these documents just keep in handy, because generally these documents are asked for by the GMC for each of the candidates. So if you don't have, or the good stand, sometimes in my country the good standing certificate takes time, so it's better to keep these kind of things handy. Now once you have submitted the application and they have sent out an email asking for the documents, and then you have submitted these documents as well, when do you think, when do I think that you will get a reply? Well, GMC generally replies to you within 7 working days, 7 to 10 working days. And hopefully, if all the documentation is well and good, you might get your GMC registration within 2 weeks, 4 weeks. Mine arrived within 4 weeks, and but for every other candidate, it's different. Now, the next question comes is when to start applying for jobs. The best answer would be that I feel is just after you have received your PLAB 2 results, because the jobs available is all the people reply, the NHS jobs people reply after the closing dates of the application, and by the time you have applied for a job, the closing dates are generally 2 to 3 weeks from that, and by the time you've submitted your GMC application for registration, you start applying for jobs. By the time you get an interview, you might get your GMC registration, and you'll have a one essential criteria done by that time. So start applying for jobs, many jobs, as many jobs as you can apply every day. Use track jobs and NHS jobs websites, both of them, and hopefully you'll end up in UK very soon. Now keep in mind, getting a job in NHS is not easy. So for that, what you could do is you could do a clinical attachment, you could do ALS courses, ATLS courses. There are in India as well, there are some courses. Sometimes the Royal College people come and conduct ALS and ATLS. So keep a watch on online if you find these courses in India. Even if you have an AHS certified ACLS or ATLS course, some people have done that as well. At least you'll have something to show in your CV that you are interested in a particular field. Okay, so hope this information helps you to plan your PLAB journey. And if you have any questions, you can ask me down in the comments, and any video ideas if you have, then you can also put that in the comments. If you like this video, please like this video and share it with your friends. And any constructive criticism will be taken on a positive note, and hope to improve the quality of this video in future. And thank you for watching. Have a nice day.